at the end, RAMSES is combining this bottom-up and top-down approaches. At the end, even we are focusing in some case studies analysis. We are also trying to simplify approaches which can be transferable to other cities. And we also have, during the project, intensive stakeholder dialogues. And we also involve in this project some media and education experts in order to transfer all the knowledge we are developing in the project to the education or to the stakeholders. In this sense, what will RAMSES offer? Well, we are already offering some detailed case study description regarding risk, and also a proposal of adaptation options and the cost. We are also offering some tools and models which are helping understanding the main impacts expected on cities for different hazard and exposed elements. We also developed the transition model, which is based on the adaptation pathway approach. And we also developed a new cost assessment tool for some climate threats. So mainly these are some summary results of the project. Even they are more, you can check the web page in which we are uploading all the deliverables and all the products of the project. So the main work package organization of the RAMSES project, we can divide the work package into groups or 3 groups, more or less. The first work package 1, 2, 3, and 4 are more focusing in understanding the risk that can have a city. So we are analyzing more the impact, the vulnerability, and also the consequences or the risk. And then in the work package 5, we are focusing more in cost. In work package 6, we combine this analysis of risk and economy, but we only focus in the health sector. And then in the last work packages, we are covering more the policies and planning the steps of the adaptation cycles. And then the last work package are more focusing in the stakeholder dialogue and the knowledge transfer to city. So this is the main structure of the RAMSES project. And I will show some, results, some examples of the results we have in the project. This is one of the examples of the top-down approach, in which we have some high-level risk assessment for which we are giving a risk number to each urban outlet city. So this can be one example of this top-down approach. And then we are combining this top-down approach with the bottom-up approach, in which we are focusing in more detailed analysis in some case studies. And here you have an example of the pluvial flood maps, which has been done in Antwerp and also in London. And some case studies are analyzed with this pluvial flood modeling, and we are giving some results like this kind of maps. Then also we have for heat, we have some historical and future projection of heat waves for different European cities. And this heat analysis also is combined with the cost or with the economy. In this sense, it has been studied the high temperature influence in the work productivity and how this is affecting to the city economic production. And well, some examples of the economical analysis we did. We have this cooling energy demand analysis, but also other kind of results like which are the main cost, or which are the main damages in different scenarios in different cities. So we can analyze the averted losses thanks to some adaptation option. Here you have the comparison of air conditioning, solar beams, increased insulation or ventilation or behavioral changes, and we can compare with which adaptation option we can avert more loss or less. So this kind of information can help to the cities to take decisions. So this is the main idea of creating data and then transferring to the city. And in the next slide, we have the example of the combination of the heat study with health. So we are analyzing how heat is affecting the health sector and which are the main economical impacts that can be caused this heat event. So at the end, we analyzed the mortality, morbidity due to this heat effect, and this is the example of Skopje. And we created, we did some economical valuation and then some proposal of adaptation. At the end of all these studies, the second part of the project is more focusing on this governance, planning, and knowledge transfer. And in sense of governance, we detected some barriers and enabled to see how we can success in this adaptation process. In sense of planning, we analyze the pathway approach, and I will explain further in the next presentation how can help the pathway approach in the planning process. And then we also, for the knowledge transfer, we have like 3 main products or results that can help to the cities. One is the handbook, which you can see this in the web page, and it's summarizing the main results of the RAMSES project, giving some tools, methods, and recommendations on how can a city go through the adaptation cycle. And then we have also supporting this transition handbook, the training package, which helps also the cities start working in this adaptation cycle, and the audiovisual guidelines. So we have all these materials that can support the adaptation cycle. We also did during the project the stakeholder dialogues. So we also have these webinars, but we made several stakeholder dialogues in which we presented some project results with the aim of share the information, but also validate methods and approaches. So we used this stakeholder dialogue for sharing and also validation, obtaining feedbacks, and we included all these feedbacks and results in our research. So we can consider these stakeholders as a co-creation event, which has been very useful for us. And we hope that this can be useful also for the cities. And at the end, we are developing some RAMSES policy briefs, which are a policy relevant summary of the project. This is a short summary of the RAMSES project, but you can find more information in the RAMSES webpage.
Thank you very much, Maddalen, for this comprehensive presentation. If any of the participants or attendees have questions to this, to the RAMSES project in general, please feel free to write them in the general chat to all panelists, and we will make sure to take them in the next Q&A session after the WHO presentation. And I would like now to hand over to James Creswick from the WHO to give us the presentation on climate change and health.
Good morning. Hello. Yes, so I am now just going to give you an overview of the perspective of climate change and health in the WHO European region. One thing I'm just going to start off with an explanation there is the WHO European region is actually a lot larger than what people initially think of when we say Europe. We actually have 53 member states in our European region, going all the way from Iceland to the all through Central Asia and the Caucasus Republics. So we sometimes see a little bit more of a different perspective compared to, for example, an EU perspective. Starting off a little bit broadly on global environmental burden of disease, this slide just shows you a few of the statistics that came out of our recent global burden publication. And as we can see, I particularly am highlighting on the right-hand side of the slide here, air pollution and climate change have really been pulled out as being significant components of the environmental burden of disease. 23% of all global deaths are linked to the environment and environmental determinants. And this is one reason in our office here, we have a whole office focusing entirely on tackling those environmental health determinants. Specifically from a climate change perspective, health needs to be recognized as the bottom line of the response to climate change. And identification of the health sector as a priority for adaptation from a global to a local level. Protection and promotion of health is a central criteria for supporting mitigation and adaptation policies to protect the population of the European region. There are many pathways in which climate change can affect health. This diagram is to show that conceptual framework showing the three primary exposure pathways by which climate change affects health. That can be directly through weather variables such as heat and storms, or indirectly through natural systems such as disease, and particularly vector-borne disease, and pathways mediated through human systems such as malnutrition, refugees, so displaced people. But there are many ways that these can be, these influences are moderated, and the local environmental conditions and how climate change exposure pathways manifest in a particular population. They're not uniform across the entire region. And finally, the extent to which the three categories of exposure translate to actual health burden is moderated by factors such as background public health, socioeconomic conditions, and adaptation measures already in place in the particular areas. Just to hammer home that point, it's very complex, and I think this slide is, I'm not going to explain it in detail, but it's just to show you that those pathways, those direct and indirect pathways on how climate change affects health are complex, and they actually the cumulative effects as well. And clearly flooding is one side of an extreme weather event, but at the same time it can also have impacts on disease and shelter and injuries. The main relevant climate-sensitive exposures can really be divided into four broad categories. We have extreme weather events, which heat waves, cold spells, storms, floods, droughts, fires, etc. These have been shown to be increasing in frequency and intensity and they affect the fundamental determinants of health. Particularly, heat is quite definitely a direct impact on health. As I said, flooding and droughts can have many indirect pathways, such as affecting food security and water safety and security. We have changing distribution of infectious diseases, specifically vector-borne diseases, and I'm going to come back to that a little bit later on what those specifically are. They're changing in temporal and geographical distribution due to climate change, and air, food, and water security, as I've mentioned, can be indirectly affected by climate change, and these can also be long-term changes due to global climate change. But they also constitute the basic fundamental environmental determinants of health. And then finally, as I mentioned in the previous slide, the human-mediated impacts and social factors underlying social development, which in many aspects are indirectly affected by climate change, causing impacts on population health. So just recapping, this is what we know, that health is sensitive to the climate change shifts in weather patterns. It's adding to the burden of disease worldwide. It's not a even and equitable distribution of burden, and vulnerable populations are most affected. And the particular largest risks globally, it's undernutrition. In the European region, it's extreme weather events and infectious diseases. There's a high level of diversity in our region. This map shows you what I was saying right at the beginning on how broad our region is. We go from Arctic regions, which will see increases in temperature and heavy precipitation, which can actually cause changes in the social structures and, for example, access to health services, particularly if we start considering permafrost reduction and the retreat of glaciers and flooding. But then, for example, if we jump down to Central and Eastern Europe, or particularly Central Asia is a good example, it's going to get it's going to get hotter. There's going to be varying trends for precipitation and dryness, and that's going to particularly have an impact on food production and thus food security. Water security is also going to be increasingly a challenge. So we very much have a difference in how climate change is going to manifest in different aspects of our region, from increase of temperature and wetter weather generally in the north to in the south, hotter weather and potentially drier with particular impacts on water and food security. As I said, vector-borne diseases. This is an example of the three main categories of vector-borne diseases that are changing in distribution in our region. We have mosquito-borne diseases such as dengue, chikungunya, malaria, West Nile, and potentially Zika. We have sandfly-borne disease, leishmania, and tick-borne diseases, Lyme disease, tick-borne encephalitis, Crimean Congo hemorrhagic fever. On average, 77,000 Europeans fall sick from vector-borne diseases every year, and mosquito species responsible for those mosquito-borne diseases, particularly Aedes aegypti and Aedes albopictus, are re-emerging or emerging for the first time in Europe. This is something that we definitely keep a close eye on for monitoring. This is no good news. That sounds very pessimistic, but we can see that the number of warm days exceeding the 90th percentile have almost doubled since the 1960s across the European region. And Europe has experienced several heat waves since 2000, and I mean, we're very, very aware of these. A lot of people, we're living during this period right now. And under a high emission scenario, very extreme heat is projected to occur at least every 3 years in the second half of the century. Health impacts of climate change. By 2030, we predict approximately 250,000 excess deaths a year will be due to climate change-mediated health impacts, particularly heat, malnutrition, vector-borne disease, and diarrhea. So this is not a trivial figure. This is really going to be a major impact on public health. Now, just to shift a little bit onto the mandate for the work that we do on this. WHO, we have World Health Assembly resolution to actually tackle climate change. We also, in the European region, through the Environment and Health process, we have 2 declarations from ministerial conferences, one, the 5th Ministerial Conference in 2010, and now this 6th Ministerial Conference that was this year in 2017, specifically targeting climate change. And also we have the Health 2020 European Policy for Health and Wellbeing. That's not to mention, of course, that we have the 2030 Agenda for Sustainable Development, which also very clearly has a climate change component, as well as very broadly tackling health. Just to highlight that these are the ministerial conferences I was talking about, and particularly the last 2, 2010 in Parma and 2017 in Ostrava, had a specific focus on climate change. I'm just going to jump in during the declaration here on the commitment to act, which I mentioned in the last bullet point. There was welcomed a European Regional Framework for Action, which had 5 objectives tackling climate change. The first 2 are very much looking at how we integrate health and climate change into all policies, into their reciprocal sectors. Then we're looking at raising awareness, and then look at how the health sector and the environment sector themselves can tackle greenhouse gas emissions. So that's the mitigation component. And then finally, to share those best practices. Building on that, we've recently had the 6th Ministerial Conference on Environment and Health, and I want to just highlight here, of the 7 key focus areas, 5 and 6 are particularly relevant in this presentation. 5, looking at adaptive capacity and resilience to the health risks related to climate change. And 6, supporting the efforts of European cities and regions to become healthier, more inclusive, safe, and resilient. And if we take those together, that is very much looking at how we are tackling climate change in urban environments. WHO supports our member states in many, many different ways. This just highlights a few of those areas. We pilot a lot of our projects in Central Asia. So here this gives an example of some of the work we've been doing in Kazakhstan, Kyrgyzstan, Tajikistan, and Uzbekistan. And that's been a strong focus on strengthening communicable disease surveillance and public health services in those countries. And in Tajikistan, for example, implementation of small-scale water safety plans, which is then tackling the water security issue. We also looked at, in Albania and the former Yugoslav Republic of Macedonia, looking at air quality, communicable diseases in both those countries, and also particularly in Macedonia, looking at energy efficiency in hospitals, which jumps back to how we can actually be working in the health sector to tackle climate change. The WHO develops many tools to support our member states in that fight against the health impacts of climate change. The first step is often a health vulnerability and impact assessment, looking at, in a particular country, what are the health impacts from climate change going to be and how are these going to change. Then looking at the risk assessment and the cost of what the health cost of climate change will be, and then specifically targeting those priority areas with tools and guidelines on how to actually develop legislation or public health policies to tackle that. And then we can also help afterwards to do a policy impact assessment to actually continue that iterative process of policy making. Part of the work of our office is to identify what those best policy options are tailored to the member states and support the member states in selecting and then in particular implementing those policies. We also highlight that in global conferences on climate and health. This is where the WHO comes together with all the member states globally to actually highlight what the health impacts of climate change are, sharing best practices, and actually pulling together the global, both the policy making and the academic community to actually discuss and come up with a way forward. And we've been doing this for many years. The first conference was in 2014, the second conference was 2016, and we also have been very active during the climate change conferences, during the COPs, raising the profile of climate change being a health issue, and that we really need to be working together on this. A little bit of a focus on cities. In many countries, the majority of the population lives in cities and urban environments, and as well as a global trend for urbanization, this has generated a greater future role of cities. Cities tend to be progressive and open to new concepts. Also, in many of the climate change impacts, they tend to be amplified or magnified in urban environments. One example of that is the urban heat island effect during heat waves. They can't be dealt with purely in isolation. They clearly have a wider impact, and this can also comes down to their spheres of influence, regional perspectives, but it can also be their environmental and geographical location. For example, if they're on a coast or they're on a shared river. So it's a case of also trying to work with cities in groups and trying to identify cities that are facing similar impacts and using those examples to share best practices between the cities. Cities are also the core of annual economic activity in many countries, in most countries. And as a result, they also can be one of the major causes and hence the target for mitigation actions. And 71 to 76% of global energy-related greenhouse gas emissions are from cities. So clearly that gives us an argument for our focus. This is just to give you a very specific example on what a projection that we did for Vilnius in Lithuania. If you look at it's very small text here in the slide because I've tried to put a lot into one slide here. But if you look at the top left graph, we have here the annual mortality. The black line is the annual mortality attributable to heat waves, and the red line is the annual number of heat waves. And you can see over time that clearly the number of heat waves is increasing, and also the mortality, not just with the number, but the overall mortality due to heat waves is going to increase significantly. The second graph on the top there shows this a similar. It's showing it for cold waves. So we're showing how the mortality is actually dropping due to cold waves, and the mortality is, as a result, also going to drop. The final graph at the bottom is showing what the difference between annual heat and cold mortality is going to be, again, over time. And you can see over the next century, we're seeing a very stark increase in the difference between heat versus cold mortality. As I mentioned before, this is clearly, in a global context, but also for us in the European region, health and well-being are an outcome, determinant, and enabler of the social development goals. And we clearly can't tackle these in isolation. It's very much looking at them as a whole. In the bottom left here, you can actually see how we consider health as really being a central component, and that we can actually look at all the SDGs and show how there is a specific health component to that, and how we can actually be working on implementing the SDGs. Now, clearly, there's a few of those which very obviously have a climate change component, such as looking at water. I mean, there is the SDG on climate change, but looking at water and food security and urban environments that we can directly draw a link to health in those areas. More specifically, we could actually even argue an environment and health component to pretty much all the SDGs. Just some of the other work that we're doing broadly in environment and health, which then is tackling climate change and particularly in urban environments, is public transport and active travel, looking at low carbon energy in urban environments, safe access to green spaces, which has also the impact of increasing urban resilience, particularly to flooding, for example, and improving water and sanitation. We also have a strong initiative looking at urban green spaces in cities, and on the right-hand side of the slide there, it's showing you a couple of our publications that have recently come out on urban green spaces, particularly the Brief for Action gives a nice overview of our work. And recently, we're also involved in another project, which is called Blue Health, where we're also looking at the impact of blue spaces. So this is blue infrastructure, water-related infrastructure, which could be anything from coastlines, rivers, to man-made water infrastructure, and how that's actually going to have, it's going to have an impact on health, in all aspects of health and well-being, but also how they can also have an impact on or modify the impacts of climate change in urban environments. Anybody interested in more information, I would like to recommend that you turn to our website. Any of the publications and material that I've just mentioned are all available on our website. There's a separate link on the left-hand side there where you can jump to publications. And all the projects that we have, the results and everything will be published there on the website. For any specific questions, my name is also, last slide. My contact details are here, and I'm the communications officer for the WHO European Centre for Environment and Health, and I'm happy to also take questions and also liaise with my other colleagues working in those specific areas, such as water, climate change, urban environments, to answer any specific technical questions. Thank you very much.
Thank you very much, James Creswick, for this presentation. Quite interesting to know the length of work you've been doing on this topic. And we will now have our Q&A session. And we already have a couple of questions which I will pose. So feel free to jump in and answer where you feel you can contribute. So I think the first question is probably on the general presentation, and that probably goes to you, Maddalen. And it's about the slide on, so it says here, you presented on the high-level urban climate risk assessment on hazard exposure and how to calculate risk. So which cities have you worked with, and is there a tool that is accessible for people interested in knowing more about this?
Yes, for sure, this is you can download the main results from the RAMSES web page. The deliverable is the 3.1, and we did for the urban audit cities. So for more than 500 European cities, we have the results. And you can also email us if you need further detail on the deliverable or some specific information that is not in the deliverable. We can just exchange emails, and because this deliverable we did between Tecnalia and the University of Newcastle. The Newcastle University did the hazard analysis, so they made the projection for drought, heavy precipitation, temperature, and then in Tecnalia we analyzed the vulnerability indicators. So we did the analysis of the sensitivity and the adaptive capacity of these cities, and then we combine all the information and we create the index, the risk index, and we provide these maps with colors, giving some idea of where is each city regarding the risk analysis.
Thank you very much, Maddalen. The second question is, what mandate does the WHO have to work with cities, and how do you coordinate it with your work on a country level? Also, are the tools adapted for cities or city officials to use?
Yes, I think that question's for me. So the most recent mandate is clearly what I explained in terms of what we had in the ministerial conference, the last ministerial conference in Ostrava this year. That was the 6th ministerial conference on environment and health, and that conference had a declaration, and that is all the ministers of environment and health or their representatives from the European region agreed to the declaration, and as I said, of the 7 key focus areas in that declaration, one was to strengthen adaptive capacity and resilience to climate change, and the second one was specifically supporting the efforts of European cities and regions to be more healthier and resilient. It's interesting that, yes, we included in that declaration, we had a compendium of actions, which is a whole list of, and I would recommend, if you're particularly interested in this, to look this up. As I said, it's on the website, but this is a document that actually gives examples in all of those 7 key focus areas, examples of activities that could be done to actually achieve those objectives. And one of the things that the declaration does is it calls on member states to actually come up with a portfolio of actions by 2018 on how to actually implement those objectives. In terms of targeting our tools, we do definitely work with governments. So what often happens is we start looking at the national level and working on how to adapt our tools to a national level, but then the next step to that would be looking at then, okay, how do we take those national tools or like a national policy assessment and actually translate that down to a regional and local level, and then specifically where requested, looking at in specific cities the activities that they can do. And I showed an example of some of the projections we did for Vilnius. That's one example where we can actually look at an assessment of the future projected impacts. Another aspect can be in a few cities we've had requests to really help develop heat health action plans. So that can be then very much looking at if maybe they already know what their impacts are going to be and how we can actually now support them to develop tailored public health interventions to actually minimize those impacts. So yeah, we do then take a lot of our material and help work with the country or with the city to actually tailor that to their specific needs.
Thank you very much. I think we have one final question for you, but let's try to keep it short because we have one more presentation, and it is, does WHO have specific support activities which enable city departments to use the WHO tools, or do cities need to engage with local researchers to make use of these tools?
So a difficult question to answer. It really depends on what the tool is. I can't sort of say that across the board that's the case. There are specific tools which are tailored to cities already, but in many cases, with getting in contact with us and actually working with us, we can actually work to actually make those more accessible.
Thank you very much. Now I will hand back to you, Maddalen, to give us the next presentation.
Hi, hello again. Well, sorry. trying to find presentation.
Yeah, I just put it for you here. Hello, Maddalen?
Yeah?
Yeah, can you see it? It should
No,
be on the screen now.
yeah, no, I'm moving, but...
It's right, this one. I just moved it for you. Right.
Yeah, I can see it now. Sorry. Well, I'm going to talk about how the pathway approach has been applied in the Antwerp case study in RAMSES, and how has been this process of transferring the adaptation pathway approach to Antwerp. Well, first I will explain a little bit what it means, the adaptation pathway approach, what it is. I will briefly explain the methodology we applied to create these pathways, and then the Antwerp experience, and which are the main conclusions we get from this experience. So one important, the most important aspect for the adaptation planning is the flexibility. So we selected one of the approach which can be used by, to support the adaptation cycle, and which has this characteristic, which is the flexibility. So in this sense, the adaptation pathway considers this actual situation, then the near future, but also it's not a closed product. So it leaves open the option to change this pathway in the future. So this is one important characteristic of the adaptation pathway. And also, some key aspects of this flexibility are that we can monitor and learn before making a major investment. So this approach allows us doing this. It also incorporates this structural flexibility that we are considering the adaptation option that can be adjusted in the future. So this is a good point of the approach. And it can be also updated with new climate or socioeconomic information, which is important due to the uncertainty this data has. And also, this approach, I would like to highlight that it's not a new approach, which, it's not complementary with others. We can use this approach as a complementary of the adaptation support tool, for example. It will be in between the assessment and selection of the adaptation option and implementation. We can use this adaptation pathway approach to help doing these steps. So in summary, what we applied as methodology, the adaptation pathway has these 5 general steps, sorry, and then different sub-steps. So we start, as always, defining the objectives. And this is done through this system analysis, understanding a little bit the vulnerability and risk, and defining the threshold. And then we move to selecting adaptation option. But we do this first, reviewing the existing plans in order to detect the existing adaptation option, and then we start identifying new adaptation option, and also we characterize this adaptation option. Then we start defining the pathway alternatives. So what it means, we group the adaptation options, and we assess how effective they are, which is their cost efficiency. For example, if one greening roof, how much the temperature can be reduced thanks to the implementation of this adaptation option. So we use this information in order to sequence over the time the different adaptation option, and then sorry, we start detecting when we need to activate a new adaptation option, because it's not enough with the adaptation option we already selected. And then, well, we make different pathways because we have a lot of possibility in our hands. And then we work on recommending a preferred adaptation pathway. And then the last well, step is very important also, also the implementation, but the monitoring, because at the end, the pathway, how effective are these adaptation options need to be monitored. And then the decision will be taken depending this monitoring and the main effectiveness that we are looking at on the adaptation option. So well, this approach has been applied in Antwerp, and well, we start defining what we want to make for the adaptation pathway. In this case, we start analyzing the heat effect on Antwerp, and we focus on two main impact chains. What are the impact chains? The impact chains are combining the main hazard with some impacted elements. So we analyze the effect of heat, for example, in human health. And we also analyze the effect of heat in work productivity in the second hand. So these are the main impact chains we analyze it in Antwerp, and I will show a little bit how this is done. So in the first step of defining objectives and analyzing the system, we need to define some threshold which at the end will allow us defining the main objective of the adaptation pathway. So we need to define this threshold for each impact chain because they are very different among them. From one hand, we have this heat to human health impact chain, in which we detected some temperature threshold, and from the analysis done, for example, from the federal plan, we detected that the acceptable threshold for the federal plan it's 18 degrees for the minimum temperature, 13 degrees for the maximum temperature. Well, there are some definition of when a plan needs to be triggered, and this can be used to define the acceptable threshold. And in this case, we then calculated which are the difference regarding the historical and future projection on temperature. So this difference allows us defining the main objectives. In this case, for the reference temperature, the main objective is that we need to reduce 5 degrees the minimum temperature in order to avoid activating the plan. For the near future will be 7 degrees, and for the far future will be 10 degrees. So depending how restrictive we want to be, we can change the main objective. So this needs to be done together with the stakeholder, and we need to define how we want to define these main objectives. In the other case, for the heat to work productivity, for example, the main variable we are measuring is the lost working hours, and we defined together with the stakeholder the acceptable threshold of 1% of lost working productivity. And then we analyzed it, how much we need to reduce the lost working productivity in order to keep this acceptable threshold. In this sense, for the reference period, we need to reduce 3% the actual lost working productivity, 6% in the near future, and 14% in the far future. So this will be the main objective of the adaptation pathway, and we need to find the right adaptation option that can keep this objective After defining the threshold, what we need to do is to see, well, how is our city regarding these risks. So we need to carry out a vulnerability analysis, or almost we need to gather different information that we have from the city to see how vulnerable it is. What we did is we defined 3 levels of vulnerability analysis, and we detect for individual level, for building level, and for city level, which are the main vulnerable locations. So explaining more these 3 levels, so this will be the exposure, which are the main elements exposed to this heat, and we identified the most vulnerable population in this case, or most vulnerable building, or most vulnerable city areas regarding the heat hazard. And we also projected it into the maps in order to see where and why we have this kind of vulnerability into the city. Well, this information allows us to go to the next step and to start identifying the adaptation option. Also, before starting proposing new adaptation option, we need to start reviewing the existing plans and detecting which are the main adaptation options that are already in place. So this is an important step that we need to do together with the city stakeholders. And this allows us to defining this adaptation canvas in which we are including the 3 main levels analyzed, and for each individual building or city level, we are including a different adaptation option that can help keeping the risk below the acceptable level. So in this case, we are proposing different kind of adaptation, like institutional ones, social or behavioral one, and structural or physical one. And what we try to do with this canvas is to detect which are the adaptation options that we can include in the adaptation pathway, and then which are the performance criteria, or how can we measure the effectiveness of this adaptation option, which are the 2 main key components of the adaptation pathway. In this case, we start defining the pathway alternatives. So as I said, the pathway alternatives are a group of adaptation options, and we start assessing the effectiveness of each adaptation option. So in this case, for example, we have the heat to productivity impact chain, and we are including in this pathway 1 to 4 of the adaptation option that we have in the adaptation canvas. This adaptation option, each one has an effectiveness. So they reduce the impact, and we have this type of reduction. For example, if we select the moving to cooler places, this will allow us reducing the lost working productivity 3%. In black line, we are including the main objectives we want to achieve with this pathway. And in this case, in the reference period, we want to reduce 3% the lost working productivity. In the near future, we want to reduce 6%, and in the far future, 40%. So we can see with this graph that moving to cooler places is enough for the actual period, but for the near future, we need to activate new adaptation options. So in this case, we can select the solar beams, but also the ventilation or changing working hours. So we need to combine the adaptation option in order to achieve this objective for the near future. We did the similar approach for the heat to human health, but in this case, we have the main objectives are more difficult to achieve, so we need to put in place more adaptation option because well, it's more difficult to reduce the outdoor temperature at city level. So when we analyze the effectiveness of this adaptation option, for example, planting extra trees, well, we can have a lot of effectiveness or reduction on temperature if we plant a lot of trees. So we need to, well, start thinking on what is possible in our city, and while discussing with the stakeholder, we made the decision that the city of Antwerp, well, it's difficult to plant 50% extra trees or well, change and include 60% greening or change the urban configuration. So these three measures are the most effective. This is true, but they have well, more barriers for the implementation. So we discussed the need to include additional measures, and one of them is the accessibility to cool areas. So we can detect which adaptation option we need to achieve this objective for one hand, and then if it's possible or not to implement this adaptation option, and if we need new additional adaptation option.
Hi, Maddalen, sorry to interrupt, but I just want to give you notice that we have only 2 minutes left for the presentation.
Okay, I will go faster, sorry.
Sorry.
So at the end, well, we are sequencing in this picture this adaptation option over the time, and well, you have this existing system, and then you can go through one pathway or through other pathway, depending the main effectiveness of the adaptation option, but also depending the implementation barriers or other barriers that can be found. So the aim is that we have different pathways. We can work recommending or selecting one adaptation pathway, but well, at the end, the most important thing in this point is that we also need to combine this information with monitoring, and this will allow us to see if we need to follow the selected pathway or if we need to change to other pathway that we already have defined, but we didn't select. So the monitoring is a key issue for the pathway approach also. So the main conclusion from Antwerp are that, well, we have been able to detect these, well, which are the main problems of the city. So the system analysis, which is the first step before doing the pathway analysis, is very important and well, can help us to defining which are the main critical elements to be analyzed. And also the process, well, it's important to start implementing this process in order to detect which are the lacks of information, the needs that has a city, if they need a monitoring system or if they need new information. And also, well, highlight that the lacks that we can detect applying this process can become in the future well, new work to do. So I think that it's important to start applying this approach, even that's even having less or more information. So I have some questions, and I will conclude fast. That we saw that it's possible to apply this approach in different city contexts. We have the experience of London. They already implemented 3 different impact chains for flood, heat, and water supply. And also Rhine Delta and New York, there are some experience, and well, we think that it's a good approach. Then, well, even you have not a lot of information, you can start applying this approach, because at the end, the adaptation pathway can be applied at 2 different levels with more or less information. The important thing is to start applying this, and you also can consider different information, even it's not the most accurate one, and then start completing this lack of information. And regarding the resources and capacities we had to use in Antwerp, we only count with one stakeholder from the city and one local research organization. So it's easy to start with, and well, you can see that the main conclusion can help to take decision. And well, this is I think that's all from my side, and thank you very much.
Thank you very much, Maddalen. This was a very interesting presentation, quite useful information. And we actually have some questions for you. So the first question, I hope that the person who posed it agrees with me, was answered with your first question about it being applicable in different city contexts. So I will move on to the other two questions. One of the questions was, which might have been answered perhaps also in your last slide, relates to the stakeholders. So the question is, how can stakeholders be engaged, and from which sectors do you engage them?
Yeah, well, here, depending which impact change you want to analyze, at the end, well, you need to involve different technician or stakeholder from the city. In this case, well, if the climate change is, there is a department of environment and they are working on climate change, well, it's important to involve them. We try to involve one key person in the municipality, but then this key person has been in contact with all the departments, because at the end you need a different type of information, geographical information, and this person needs to be in contact with the different departments.
Okay, thank you very much. And the second question was, you mentioned that it can be done with less information. Can you elaborate on that, and doesn't that affect the actual results and the accuracy of them? And then the other question, I think we can put them together, relates to the fact that you mentioned you only need one stakeholder from the city. How is that feasible?
Well, regarding if you use less or more information, for sure the results will be different. But the main message is that even you have not all the information, you can start working with, because at the end it's the adaptation pathway is summarizing a little bit all the problems you have, and even you have no idea in one sense of the effectiveness of one adaptation option, then you can start parallel research project to analyze, but keeping the first pathways with less information in your, keeping alive. So you can include new information in the adaptation pathway, and you can change this adaptation pathway. So the process is not, the idea is not to do one pathway and close the process. So you need to, elaborate more. In this case, for example, in Antwerp, we have some effectiveness data specific from Antwerp, but in case we didn't have the right information of one adaptation option, we went to literature, and we took from other studies which are the main effectiveness in other cities which are comparable with Antwerp. So I think that it's possible to start working with, and it's important to start in order to detect which are the needs and the lacks of information in order to cover them. And the second question was?
It was about the one stakeholder, but it was about the one stakeholder?
Sorry?
It was about the one stakeholder, if it's enough or feasible to just have one stakeholder.
Well, I think that the most important is that you need to involve them, and they need to feel that the pathway is their product somehow. So it's better to involve more people, but it's difficult that all of them feel that they need to push to have this. So I prefer to having one more involved than less involved people. So in this case, for Antwerp, it works because this person did a lot of work inside the city, and she has a lot of communication with other departments, and she success gathering all the information. So it was great to working with one in this case.
Okay, thank you very much, Maddalen. Thank you very much, James. I think it was a very interesting and very useful webinar. And thank you to all our participants, and sorry for the 10-minute increase in time. Please stay in touch and feel free to visit our webpage where you can get more insights into the research outcomes and the different tools that we discussed today, and even some other ones. Thank you very much, and I wish you all a very good day. Bye-bye.
Bye-bye.